The next question, the member for Scarborough-Guildwood.
Thank you, Speaker. My question is to the Deputy Premier. Research from the Katusi Centre for Social Medicine and UHN used national FSA data to demonstrate that people who live in hotspots in Toronto and Peel are on average twice as likely to be racialized and more likely to meet low-income thresholds. This pandemic has shown the need for evidence and equity in health. People in hotspot postal codes are more likely to be working throughout the pandemic in low-wage essential jobs, which puts them more at risk. Yet Ontario lacks in collection and availability of this necessary data. The government put forward Bill 283, which requires the recording of some data during vaccination, but does not require individual socio-demographic data. Speaker, we will be presenting amendments to address this gap. Will the PC government work with us and support these changes so that we can better track and address any gaps in terms of health outcomes for people in hotspot postal codes by mandating the collection and individual socio-demographic data in our vaccination process?
Minister of Health.
Thank you. Well, I thank the member very much for the question. As she will know, the bill that is now before the House will require the essential data that we need about the name, contact information for the person, and the type of vaccine that they received in case there is a need for booster shots in the future. We don't know yet. We don't know. No one knows yet. What we will require in the future for revaccinations or booster shots. However, with respect to the collection of socioeconomic data, this is very important information to collect. I agree with you that this is something that we are going to be collecting on a volunteer basis from people, asking them with respect to the sex, their gender, their ethnicity, their total household size and income, so that we can understand those issues and make good decisions for health across the entire province to make sure that it is equitably informed and planned. So this information will be collected should this bill pass, and it will be protected with the
Thank you. Thank you. Supplementary.
Thank you, Speaker. And back to the Deputy Premier. If you say that data is essential, then we should make it mandatory. Having a voluntary collection, it just creates a patchwork, and it doesn't give us the health equity information we need. So my question is about Bill 283 in terms of how the government will go about helping and supporting the collection of that data, making sure that it's safe to do so, but also the reporting of the results. Because we know that there is a problem with vaccine hesitancy in some communities, and the government is late in tracking the data on vaccinations because it's already underway. So we're just catching up, and we are missing a big piece of it without the socio-demographic data. You already have collected some of this data on the testing side, and my question to you is that at a minimum, will you make that data available so that we understand the health equity outcomes of this pandemic on individuals in this province?
Minister of Health.
Well, this information will be collected on a voluntary basis. First of all, it's voluntary for people to receive the vaccine or not. We know there's going to be a certain percent of the population who will choose to decline the vaccine. In the same way, we are providing people with the opportunity to give us that socioeconomic data. This is not something which, in our view, should be mandatory. We are encouraging people to provide this information, but if they choose not to, they will not be denied a vaccine. But this is important planning information going forward. We are protecting privacy, working very closely with the Information and Privacy Commissioner, as I indicated before. But this is going to be information that will be available in a non-personally identified way for the people in health and for people of Ontario to understand where the gaps are, where we need to fill in.
Response?
And we will work to do that as time goes on based on this information.